Well, hi, everybody. Welcome back to GW Center for Integrative Medicine YouTube channel. So today we have a pleasure meeting with Calvin Richards, and Dr. Richards is our newest addition. So I'm going to give a little bit of a bio, and then we're going to jump right in. So Dr. Richards is a naturopathic doctor. He's also a certified physician assistant, PAC, with a passion for holistic individualized healthcare with over 8 years of experience in both traditional and natural medicine, bringing a unique perspective that integrates the best of both worlds. We love that. We in our clinic, that's what we're looking for. Um, Calvin's journey in medicine has taught him that true health is not just the absence of disease, but the presence of vitality and balance across all areas of life. He's committed to empowering patients by addressing the root cause of their health concerns using evidence-based natural therapies along modern medical techniques. He strives to create a partnership with each patient, listening deeply to their needs and guiding them towards optimal health. Whether you're managing a chronic condition, seeking preventive care, or simply looking to feel more energized and balanced, his goal is to provide you with personalized solution that supports lasting wellness. He believes in treating the whole person, mind, body, and spirit, and is there to support you every step of the way to your journey to health and well-being. And Kellen's best, or sort of his most expertise in hormonal balancing, thyroid optimization, low testosterone, peri and postmenopause, LGBTQ, and gender-affirming care. So just with that sequence, Kellen, let's just dive straight in. So one of the biggest intriguing things that sort of attracted me to when you applied was, of course, hormonal health for both men and women. We have several people in our practice who do hormones, but they're women. That's wonderful, but we never had well, I don't call myself a hormonal expert, and I felt that we really had a niche, critical niche, I think, for both men and women with hormonal health. So tell us a little bit about sort of your training, your expertise. How do you look at hormones? Because it's a huge topic, I understand. So just whatever comes to your mind, let's talk about that first.
Awesome. Well, first off, thank you. I'm super excited to join your STEAM team. Everyone's so talented there. So I went to naturopathic med school for 4 years, did residency after that, and then opened up my own practice in Phoenix. At that time, I was mostly focusing in men's health, but quickly learned everybody else wanted to be treated with hormones too. So I had to quickly pivot from there. Um, my training, mostly from naturopathic med school and on the job training from people that are coming in. I learned most of my stuff from my patients. Every patient has something new to teach you. When I first started off, like I said, it started with men's hormones. What I'm finding is that a lot of guys are having low testosterone even at younger ages than I wasn't really expecting before.
Mhm.
We don't really know why, but there's a lot that can be done to help optimize those hormones without using testosterone directly. So yeah.
Yeah. So I love the fact that you're sort of concentrating on a gender affirming care. I think it's critical. So we're not really thinking about who comes to the practice, and we welcome absolutely everybody, and we treat everybody equally, and we give people who have very special needs, we give them just as much, if not more, attention. And I think that does separate our practice for some other practice in the area. And I know you've been really doing a lot of this work in the past, and we're so excited that you joined us. So let's dive a little bit deeper. I really find it fascinating. You said that. I have personally been also seeing a lot more men, even in their 30s, coming in with low testosterone. Very hard to figure out why that is, except that I have a strong feeling this is kind of combination of multiple stressors, including toxins. I think, and not just stressors of like stressors the way we think about them, right? Like somebody yelling at you, but really the stressors, the chemical stressors in our body. I mean, I think there's a lot of environmental toxins that can lower testosterone. Let's just simply, how would you address it? So you have a young man coming to the practice, and he's fatigued, and he is going to different doctors, and doctors giving him clean bill of health. I mean, we see this all the time, right? I mean, we see this young man coming saying, I'm not feeling well, I'm exercising, I'm doing everything, and yet I'm fatigued, my sex drive is lower, and lo and behold, we find low testosterone. If you're looking at the TV and you're watching a movie, every a couple of minutes you have a commercial, take this testosterone pill, which of course we know is a horrible idea, unless there's no other choice. So how would you walk us through, how would you first look into trying to get to the root cause of this, and then how would you treat someone like this?
Yeah, so when it comes to testosterone, I don't only look at the testosterone, but that initial visit, I need to look at everything. I need to look at vitamins, vitamin D, B12. Looking at the thyroid, especially, can have an impact on testosterone. Of course, looking at testosterone, precursors to testosterone, DHEA, looking at estrogen, which a lot of guys don't know. I've even talked to some practitioners, they don't know guys produce estrogen, women also produce testosterone too. We both need both of them, but just in different ratios. Looking at CBC, basically getting a complete picture of somebody's health before diving straight into the hormones. Like I said, I look at thyroid. Thyroid has a big part to play with testosterone too. Hypothyroidism can be also low functioning thyroid, can also be associated with low testosterone. Vitamin D has a part to play in helping to produce testosterone. So vitamin D, that's another topic we'll cover too, why I'm seeing so many patients have low vitamin D even though they're getting sunlight. And then, like you said, toxins. What are people eating? Even some natural supplements have estrogen effects that can affect testosterone. Diet is a big one. Lack of exercise is a big one. So not only just looking at the labs, but what is the lifestyle looking like? Exercise. So looking at that complete picture and then creating a plan from there is how I address it.
Yeah. So, basically imbalances can be in so many different angles, different areas. They're not necessarily directly hormonal imbalances, like basically low testosterone doesn't necessarily mean that's the problem. I mean, the problem could be elsewhere and it's just dragging testosterone down. And then, this is what we would assess. This is what we call the whole person care. I mean, instead of just looking into, okay, low testosterone, take testosterone, which is sort of I don't know. I don't want to say standard of care because it's not. It shouldn't be, right?
Yeah, agree. Everything's connected.
Everything's connected. Yeah. So, what do you think is sort of, you've been in practice for quite some time. What do you think you find to be most challenging aspects of your work? Putting you on the spot.
Aspect of the work. Sometimes patients come in very, very sick. And addressing that we're not going to fix everything overnight and it's going to take some time. Sometimes people see you when they're at their lowest. I'm like, yeah, we should have come in earlier when we had those warning signs, but managing expectations that it's not going to fix overnight is a big one with the very sick patients. That can be one, but holding their hand, guiding them through the process, especially when they first come in, to manage expectations appropriately, often helps. So I tell patients, I'm like, how long have you been sick for? They're gonna be like, it's been a couple of years. I'm like, so it's not gonna happen in the first week that you're gonna feel better. Now, let me say, if you have low hormones, it's low-hanging fruit. So you correct the hormone imbalances, a lot of times people will feel better, but often it can take as long as you've been feeling sick for you to feel better.
Yeah, exactly. I mean, I love your answer. I think our clinic has always been kind of local area of Cleveland Clinic of DC. We're trying to always solve the toughest cases. Not that we don't do, health prevention and like a general optimization and wellness, but over the years, I think that's been our main specialty. So we're very accustomed to exactly what you said. I agree wholeheartedly. It's always very heartbreaking, when somebody could have come to us earlier and the whole process could have been a lot simpler, but for a variety of reasons that's just not happened. And actually the most common reason is people rely on the standard of care. They hope that their problems are going to be solved through the insurance, through the sort of a typical workups and stuff. And we know that that's just not the case. You know, modern standard of care looks into disease. It doesn't really have pathways of disease prevention. It has pathways to early diagnosis, identification, and treatment. That's not the same. So, all right, let's pivot to a little bit different. We thought that we're going to talk about three topics today. So let's talk about the second topic, which is, I know you've been very interested in gender affirming care. Just tell the listeners who don't know what that is. I mean, not everybody understands the term. Everybody should, but not everybody does. So how would you define this, and what does that mean to you in your clinic?
Yeah, gender affirming care, so transgender health. Sometimes for some people, their brain perception of gender doesn't match their physical manifestation of their gender. So what we're doing is we're giving hormones that match what their brain feels their gender is. It can cause a lot of anxiety when your brain and your physical aspect aren't matching. So we give the hormones that match their perception of their gender. Is that clear?
Yeah, yeah, I think so. I think that's,
I hope so.
actually, if there is a standard definition, but I'm guessing this is it. Yeah, so this is a very important topic. I've over the years have seen a number of patients who were asking me these questions, and I know how much they struggle. There's a massive shortage of providers who can provide gender affirming care, and I think I'm personally super excited that you're joining us for this particular reason too, because previously to this we have some expertise. I mean, even I occasionally would treat patients like this, but I definitely can't call myself, an expert in hormonal prescription. So, and you are, which is wonderful. So that's great. And if listeners are interested in this, we'll make sure that we're going to have a little bit of section on our website about this. We haven't quite organized that yet, but we will. We'll make sure that we have a page for gender affirming care and a little bit of a description what this entitles. And if somebody has questions, they can contact us and we can try to address if they not sure if they should come to see us.
Awesome.
All right, and then let's do the third topic, which is most controversial. That's why we left the last. It's very most difficult. So it's a peptide, right? I go to a variety of conferences, and this one topic that seems to generate tons of interest, and yet lots of confusion, constant change in the legal point of how this is practiced. And so, and I know you've done a lot of learning, and but when you practiced in Arizona, you've actually were prescribing this. So, we haven't started venturing into this, with a few exceptions. I mean, we use some peptides in the practice, but very, very, it's a small amount. We're quite excited that you're going to do this. So just talk to us what you've been seeing. Talk to us about what kind of problems you think the peptides are wonderful for, and sort of what is the whole controversy here.
Yeah. So first off, I'll start with the first time I used peptides on my first patient, which was a really cool experience, and that's what got me hooked on peptides. I had this older gentleman come in, was working with a physical trainer, could not put muscle mass on. As we get older, it's harder to put on muscle, period. He's doing nutrition, doing everything he should be doing. But I could not give him testosterone, previous history of, there was some contraindication why I couldn't give testosterone. So I'm like, look, there's this peptide, LGD4033. It's supposed to help produce muscle, but won't impact the. Now we find out it can impact hormones a little bit, but it won't have the same effects that testosterone will. So he's like, I'm like, we can try this. Are you game? Who's game? We did the peptide for 2 months. He put on 20 pounds of muscle. His trainers,
Wow.
what did you do?
Wow.
He's like, I'm back to where I want to be. I'm like, I was not expecting that. It was about 2, 3 months. And I'm like, okay, maybe these peptides are real. we need to stick with these peptides. So that was one that I used early on. Now I can't really get a hold of it because the landscape legally with peptides constantly changing. It's like you get a peptide, it's hard to find it, but there's workarounds to it. So we're currently figuring out the landscape. It's this cat and mouse.
So peptides are short molecules, so they're basically proteins, right? So they're proteins that are naturally occurring in our blood. And until maybe 10 years ago, this only was understood in a scientific community that we have all these molecules floating around and we have no clue what they're doing. So this is a most recent advance where suddenly we realize, wait a second, there's a soup of these molecules in our bloodstream. They're doing something, and suddenly there's this explosion of knowledge because people started experimenting and saying, okay, let's isolate this guy and see what it does. Why do you think it's so difficult for the standard of care clinical settings to sort of make this a boom? Because we're already using tons of peptide. Like look at the most common peptide for the weight loss and for diabetes, Ozempic. That's a peptide, right? The peptide's been in practice for quite some time. So yet there's this whole controversy. Why do you think that's happening?
I have no idea. I looked up that peptide that I was talking about earlier, why
Mhm.
it's long on the market, and I think it has to do with the legal aspect of patents and money is what that one came down to. There's other
I
peptides.
mean, this one is also endogenous, right? Or is this something else? The one you
That one, I don't know if that one's endogenous. It might be synthetic. That one might be synthetic.
okay.
I don't know.
Well, but even if the peptide is, I mean, most of the Ozempic like peptides are now synthetic, right? They're not derived from tissues. But they're still analogous, right? So they're very similar. But I guess even if they're analogous but they're not derived from us, then they can patent that because they probably patent not the final product but the process of making it. Fascinating. So like very complex topic, right? Sounds like some of them are hard, there's fights over financial rights and patents. Some are, I guess, I don't know. So I think some of them they worry about some safety issues. Although, have you seen any problems with peptides safety wise?
Not the ones I used. When I use it, I make sure that I read up on what the safety was prior to it and talk to colleagues, people who have used it. But just for example, tirzepatide, Zepbound.
Mm-hmm.
Um, I'm hearing the landscape for that is going to be really hard to get from compounding pharmacies because they're saying it's not a shortage. So that's just
Mm-hmm.
one example of how things are changing. It's like you have the patent for it with another medication, the compounding pharmacies making it. It's going to be a little harder because the company's losing money. So,
Right, right, right. So what's your favorite one? Or maybe a couple
oh,
favorite ones?
mine's
Two or
going to be
three?
basic. I love semaglutide. Come on, people are losing,
Okay.
they're getting remarkable results. People are losing weight, especially when they've been stuck for a while. Blood sugar's coming down, and then slowly transition people off of the medication, have them maintain it with their lifestyle. Tirzepatide is my next one because it has a lower side effect profile than semaglutide
Mhm.
does. The
Isn't
cart
it also more effective? Like it tends to, some people lose more weight with it.
Yeah, there's some people who don't. This is rare. Probably there have been hundreds of patients that I put on the GLP-1s
Hmm.
agonists. There have been a handful of patients, even at the max dose of semaglutide, they would not lose weight, and they wouldn't even have side effects either.
Hmm.
Those people, I would change to tirzepatide. Some of them responded to
Hmm.
it. So yeah, it's benefit.
Yeah, we're quite excited because it's now you and Ashley. So we have two practitioners who have a lot of experience in this and they're rapidly growing. So if anybody listening interested in this, by all means. And we also have a very savvy way of getting this medications because unfortunately cost is a big factor here. Not every insurance will cover it. Some people would not simply fit into certain prescription criteria. But now we have a lot of compounding pharmacies that we work with that the costs have come down quite a bit. In fact, probably a few $100s a month will get you a full treatment, and you won't need to worry about going through the insurance. And if it's working, it's great, totally worth it.
Awesome.
So what do you think the future? I mean, well, of course, forget weight loss peptides for a second. Let's talk about others one that people never heard of, like the BPC 157, for example. So what do you think the future of things like this?
People were getting remarkable results with that one too, is for gut health.
Mhm.
Works along the pathway of growth hormone. What I had to pivot to, if I couldn't find it, is an older peptide, Samorelin.
Hmm.
which also works on growth hormone. But the BPC was great for gut health. CJC is another one that worked along the lines of growth hormone receptors and helping to release growth hormone. People were getting great results with tissue repair, especially after injuries, tendon repair, stuff like that, muscle development. So pivoting, we just have to be creative in this landscape while we figure out what's going on, and then
Yeah.
pivot to older ones that are a little bit more tried and true. And then hopefully the BPC, the CJCs, they'll come back and be easier to prescribe.
So for the gut health, what particularly, like, what would you treat? Like, what specific gut problem would this be best for?
Any inflammatory conditions of gut health. I even use it with like food sensitivities or trying to heal up the gut from food sensitivities. We know that stress, toxins can help promote leaky gut. Basically, the tight junctions aren't holding the cells as tightly as they should, and then we start developing um, sensitivities to the foods that we eat, the proteins in the food. During the phase after the elimination and trying to heal up the gut is when I would really use the BPC because the growth hormone has a anti-inflammatory effect.
Good, good, very good. So, anything that you want to share with our listeners that sort of how about let's just talk for a second outside of the clinic, because I don't know, we always kind of talk clinic, 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 but like life is beyond that, right? So what's your hobbies? What are you doing out there?
What are we doing? Going to the gym regularly. I
Uh-huh.
like lifting weights. I did cardio this morning for the first time in a month. Don't judge me. I'm
I'll
currently
say.
sitting at my piano as much as I can. When I come home, I play my piano. I studied classical voice and I have a minor in music, so I wanted to
Wow.
be an opera singer. But me and languages don't work out very well. So that career was going to be very short-lived. But I love music, listening to music, playing, all of that. And
Wonderful.
watching movies is another big one. Going to movies.
So, everybody, this is Dr. Richards, our newest addition, naturopathic doctor, physician assistant. Calvin's going to be he's already seeing patients. If you're interested in what he does, by all means, contact us. We're still sort of working out exact days, but I think Friday would be for sure our first day, and then we'll kind of go from there. And Calvin can see patients virtually or in person. If you're not sure how you want to come see us, let us know. We'll make sure that we put the links to Kellen's page that's also coming on our website. And we're welcoming you, Kellen. Wonderful, wonderful to have you. Thank you for joining us.
I'm so excited. Thank you so much.